Welcome back to Medical Monday, everybody.
Welcome back.
Today we're going to talk about shoulder injury. And it's very important because right now we're in baseball season. So you typically think of shoulder injuries with baseball players, but then how does that translate to average Americans or just people like us? There's workers that have shoulder injuries. I know my wife's been doing a lot of garden work in the front yard, and it's a lot of using your shoulders.
Well, I was like, she's doing garden work. You were doing a lot of pressure washing.
Yep.
That is a ton of shoulder work that I have no interest in doing.
Well, I didn't have interest in it either, but it had to be done. And you're using your shoulders throughout all of your life. It's a very common joint to use because, we utilize our shoulders even when we're sitting. So when we're sitting and standing, we're utilizing our shoulders very, very often. So it's not like it's only we use our knees just when we're walking.
Correct.
We use our shoulders when we're sitting, standing, throughout the full range of life, things that we're doing.
Very true. And it is, unfortunately, one of the most unstable joints in the body because of just how it's placed. And a lot of it's held in place with musculature.
Yep.
And so there are a lot of injuries that are caused just from muscle injuries and different things going on there. So you can see these are different layers of muscles that exist. And under those pink things that you see, which are muscles, are the bones.
The shoulder is very complex as far as we always talk about the rotator cuff. The rotator cuff consists of multiple different muscles. It's not just one muscle. The problem with your rotator cuff is that one of these muscles will have a tear, but then the other muscles will compensate for it. So oftentimes patients don't realize they even have a shoulder injury until it gets pretty significant.
Yeah, and that's exactly it. They just don't realize it until it's a little too late or a little past the point of a certain aspect of recovery, and intervention is actually required. So, which is very unfortunate, but there are things we can do about it.
There are still many things you can do with a shoulder injury.
One of the first things is actually just rehab it at home.
Yep.
One of the best things you can do for the shoulder is exercise it at home. Even if you know you've had an injury, if it's a fresh injury, don't be afraid to use it. Continue to strengthen it, to continue to move it, because it works it through those thresholds as it recovers.
A lot of times when we talk about rehab for shoulders, it's not so much the strengthening aspect as like this guy lifting weights. It's more just the motion. You want to have those muscles fully contract and fully relax just so that they can start their healing process. That actually increases blood flow to the area. It increases the body's ability to heal that damaged tissue.
Yes.
So it's not so much weight-bearing exercises that you want to do. It's just movements. You want to fully contract and relax those muscles.
Very true. Movement. So even knowing what you do throughout the day that might irritate or not hurt the shoulder, but like kind of push it through its thresholds. If it's reaching up and grabbing that coffee mug, making sure you do that 3 or 4 times a day to continue to use that movement and just challenge it. So it is important to make sure you do those movements. And I think that's worth a share. Just saying.
Definitely. But, unfortunately, we do have shoulder injuries that go beyond a certain point. And then there's other options as far as, well, what do I do? I've done things at home. I've gone through the point of doing these stretches and exercises, and they're just not working. What do we think about?
So you mentioned questions, right? One of the most common questions for the shoulder joint is, when it reaches that point, to cut
or not to cut.
Or not to cut.
That is a very good question, and it should be thought long and hard about. Because David Lintner, the Houston Methodist Orthopedic Sports Medicine Department, noted that about 40% of professional baseball players have shoulder injuries and don't require surgery. So if they don't require surgery, that tells us that they're getting better with rehab. So 40% of them don't even need surgery, which is a good thing. That tells us that our rehab protocols are getting better and better at preventing surgery, and you see it with high-end athletes, but their rehab is nothing different as far as what rehab you can do in a regular rehab facility to get the great results. You don't have to be a high-end baseball player to get good rehab. There's good rehab everywhere that can prevent surgery.
Yes, and that is very true. So surgery, although sometimes necessary, is not always necessary, and in most cases, not.
You look at surgery as a last option, and unfortunately, as we age, we're really not good candidates for surgery. The Naval Center in San Diego noted that 37% of patients that are over the age of 36, their shoulder surgery failed. So if you're over 36, you really got to think about doing shoulder surgery. Is it the right option for you? That's a high failure rate. That's almost 40% failure.
I just want to say I'm not part of that threshold.
Well, some of us are.
But one of us in this room is.
Yeah. But other than that, what else can you do? So you've done the rehab at home. Some other great options instead of doing surgery, like we talked about, is rehab at a rehab facility.
Yeah.
So we have a very specialized rehab here, and what it does is that's without weights, that's with the bands. It's movement in there. It's being monitored so that you're doing the proper movements, because that's where we really end up with injury to our shoulder, is lifting things in an inappropriate manner. Typically, we think about lifting things. You look at your back. Yeah. Everybody says lift with your legs, but it's also very important with your shoulder how you lift things, because that is how we get most shoulder injuries.
That is very true. That is very true. And rehab is important. There's a lot of different positions you can be in. Some patients can't lay on their shoulder or can't actually do certain positions with their shoulder, so it's important to have modifications and additional ways to do it. Having true weight that we talked about, which isn't always the best option, but then also just sometimes some gentle resistance to make sure that this strength is continued to gain and we can make that progress through. So very, very important there. And then also adjusting. The shoulder, although a complex joint, it actually has a lot of different aspects to it, a lot of different joints that are involved, a lot of different muscles and ligaments and tendons that are involved. So it's very important to make sure that through the process it gets aligned and that the tissue is supported properly with increased blood flow so it can heal properly, but then also those joint spaces, whether we're talking about the AC, the SC, the GH joint. Yeah, I got a little fancy there, but it's very important to play with all of those and get them adjusted, and then also making sure that the neck.
But why is it important to make sure those get adjusted and moved? Is because they're encapsulated.
Yes.
So Dr. Gabby talked about the muscles and the rehab. We do want to do that because muscles have blood flow and they will heal with proper rehab. The joint does not have blood flow to it. They are encapsulated, and unfortunately that capsule can get nutrient poor over time with not proper alignment or movement of the joint space. So that is where a chiropractor comes in as a great resource with the abilities to help move and mobilize that joint space so that fluid can become much healthier and happy so that the joint space itself functions better.
Correct. Which is important. Muscles move joints, and muscles, I love to say, are pumps. Muscles are pumps to get fluid into those joints. Sometimes it is a little bit farther along in regards to the degenerative process or patient activity, which is where your specialty comes into play, talking about the different ways to help lubricate.
So you can move your joint and help with the nutrition in there, or we can utilize regenerative medicine to actually inject a very concentrated blood from the patient with tons and tons of growth factors to help get some good nutrition in there so that joint speeds along the healing process. Oftentimes you see this in young athletes, or even some of the adult players that are in softball leagues or baseball leagues that want to get better faster. The whole thing, we always want it and we want it now. And this is a great option for those patients to help speed them along.
Yes, it is. It's awesome. That is our Medical Monday on shoulder pain. Lots of different things that can happen. Lots of things you can do at home. Lots of options out there. But most importantly, we just want to make sure you guys are educated, know what's going on, know what you can do, and just continue to
like and share it so that your friends and family who may have shoulder injuries will also know that there's some great options for them.
There are some great options. So until next week, when we see you again.
Bye.
Bye.